Hello and welcome to Frankly Speaking, where we dive deep into regional headlines. I speak with leading policymakers and business leaders. I am Katie Jensen. In this episode, we turn our attention to the escalating conflict between Israel and Hezbollah, which has brought Lebanon to the brink of a humanitarian crisis, with hundreds of thousands of people displaced and critical infrastructure in ruins. We hear from Lebanon's Minister of Health, Dr. Firass Abiad, who has activated a war emergency plan and accuses Israel of deliberately targeting healthcare workers. As the crisis deepens, we ask, has Beirut become the new Gaza? And can Lebanon withstand yet another chapter of devastation and despair? Minister, thank you for joining us today on Frankly Speaking. Now, Israel has accused Hezbollah of using the Lebanese people as human shields. They've accused them of storing weapons in civilian areas, and they continue to resist a ceasefire. Now, meanwhile, in the midst of this, it's the Lebanese people who continue to suffer. Frankly speaking, doesn't this all feel all too familiar? Are we looking at a situation where Lebanon of October 24 is a repeat of Gaza 2023?
Well, indeed. I think that if you listen to the statements coming from Israel, you do have a sense of deja vu. And indeed, if you look at some of the areas that have been targeted, some of them are, for example, Christians, politically completely opposed to Hezbollah. There's no way that Hezbollah would be operating in those areas or even hiding weapons there. Also, if you look at our ambulances were picking up those casualties and bringing to hospitals. They were coming from completely residential areas, or even sometimes markets. We've also had targeting of healthcare facilities, hospitals, or primary healthcare centers, saying that these apartments had, for example, close yourselves and then or something of the sort. This is completely ridiculous. It is, it cannot, it's unbelievable. And also, to add to that, Israel has very good intelligence. I mean, that you could see from targeting certain Hezbollah operatives, how much detailed intelligence they have. So when they attack, for example, only this week, they have attacked almost 20 ambulances or firefighting engines. This couldn't be done, by mistake or because they were hiding because of the operatives. I think it's clearly a deliberate attack on civilians to sow an environment, an atmosphere of terror and intimidation, and to push people into a mass, exodus.
Minister, I want to ask you about the attacks on the healthcare workers in just a moment. But first, surely Hezbollah has to bear some kind of responsibility for what's happening right now. They've been accused of storing weapons in civilian areas. Most of their leaders have been killed in Dahia. This is a hugely populated area. Newspaper reports have said that they used Beirut's Rafik Hariri airport. This is a civilian facility too. And let's not forget the accusations that it was Hezbollah who stored the ammonium nitrates that exploded in the port in 2020. Surely Hezbollah has to take responsibility for the current situation today.
Well, first, concerning hiding weapons, whether at the airport or at any other location, this has all been baseless. There has been several tours and, that have been organized by the Lebanese almost immediately when Israel made the claim into the same areas where, Israel said weapons are being hidden, and the international media were part of the tours. And this were never, those weapons were never found, so to speak. The other thing is, unlike Gaza, where there are severe restrictions, almost a curfew on international media going around. In Lebanon, there is no such restrictions. International media are free to roam, and indeed a lot of them have done that, and they have went into the areas that have been targeted, and there were no signs of those weapons that are fake. Now, concerning, the fact that Hezbollah, were targeted and died. I mean, Hezbollah is, remember that these are people who are Lebanese, who have families, they live with their families. And of course, they're going to live in residential areas. I mean, this is, so the claim that, since a Hezbollah operative actually lives in the city, does that mean that this whole city is, it's being used as a humanitarian shield? Or I'll give you an example. The other day, we also pictures of the Mossad, for example, in Tel Aviv. Does that mean that now Tel Aviv have become a legitimate target because it harbors, for example, people who were in the Mossad or in other Israeli army? So I think that, again and again and again, these claims by Israel are baseless. And I think that, they have used this before in Gaza, they've used it in
Sure, but
wars.
shouldn't Hezbollah still bear some of the responsibility here today? But shouldn't Hezbollah still bear some of the responsibility?
I think that, the issue here is the targeting of innocent civilians en masse. What we have seen in Lebanon is unprecedented. And this is not me talking. This is the chief humanitarian rights in the United Nations, Mr. Volker, who said that, for example, the attacks that occurred the week before, using the communication devices, these were indiscriminate and they were clearly against international humanitarian law. And also targeting of healthcare workers. This is clearly in violation of IHN or of the Geneva Convention.
Okay, well, let's talk about that. Let's talk about that in detail. I want to ask you.
Continue one point. I'm not here to say, characterize or divide blame and say which proportion of blame lies on one party or the other. What is extremely important for us in the Lebanese government, from the beginning, we said we do not want war, and we want to remove any pretext for any actor, whether a state or a non-state actor, to continue with this. And we believe that the best way of doing this, and this is also what we are really from the international community, is through a ceasefire, both.
Yes, but of course, but right now the ceasefire continues to be rejected. We've seen many countries, Saudi Arabia, UAE, US, etc., continue to call for the ceasefire. Clearly, it's not coming. Let me ask you about some of these attacks. So we've heard warnings from UNICEF this week saying that the war so far this week, or the crisis so far this week, has been deadlier for children, than the war back in 2006. But I want to ask you specifically about those attacks on the healthcare workers, what you were saying before, that paramedics have been deliberately attacked, that we've seen Israel also deliberately attack ambulances, fire trucks as well, despite appearing to have excellent intelligence on Lebanon. Does this mean that you are accusing Israel of war crimes?
Well, first, let's clarify. The only party that is rejecting the ceasefire is Israel. All the other parties to go there, to go.
Hezbollah continues to skirt over a ceasefire. I don't think they've accepted a ceasefire.
Hezbollah has not rejected. Hezbollah has said that clearly if there is a ceasefire, they would cease all hostilities. And, the only party at the moment that is rejecting the ceasefire is Israel. Now, concerning the targeting of healthcare workers, this is something that did not start, these past few weeks. This is something that we have seen from the start of hostilities since last October. And even before the destination of these communication devices, and the Lebanese Ministry of Health had recorded 25 healthcare professionals who have been killed, whether they were paramedics or whether they were healthcare professionals. And unfortunately, in the past 2 weeks, we have seen that number rise to almost 40 healthcare workers who have been killed in these atrocious attacks. Now, concerning, do we consider this a war crime? Of course, we consider this a war crime. And as I said, let's not talk, as if this is the opinion of the Lebanese government. Why don't we go and, listen to the opinion of the chief, humanitarian rights officer, the lead at the UN. This is an expert on IHN coming from the UN. when we listen to the International Court of Justice, these are the experts on what is IHN and whether it has been violated. So these are the experts telling us that what Israel is doing constitutes war.
Now, Doctor, I understand your position as a health minister, but we can't separate the politics from what is going on. So let me ask you, Israel actually withdrew from Lebanon back in 2000, and Lebanon had a chance to be neutral and protect its interests, but Hezbollah simply wouldn't let that happen. Isn't that true?
No, that's the exact opposite. You know, when if you go back to the UN resolutions, especially 1701, in 1701, it was very clear that, first of all, Israel has to withdraw from all of areas in Lebanon, which did not happen. And up till now, Israel still occupies Lebanese territory. Second, it's very clearly mentioned that Israel should not violate Lebanese airspace, which also did not happen. And Israel has been violating Lebanese airspace continuously, you know, since the 2000s. Partial withdrawal from Lebanon. So indeed, you know, unfortunately, these actions by Israel gave the pretext for Hezbollah to continue doing what it is doing now. But let's be very clear, Israel didn't fulfill that part of 1701. And even now, Lebanon is saying we are ready to abide by the UN Security Council resolutions.
But is the Shiva Farms worth what is happening right now, Minister? Because surely a negotiated deal would have been a far better option.
Well, but that depends on the other party accepting a negotiation. And up till now, it has been very clear that Israel is not interested in a negotiation. I mean, as I said, let's go back to your first question. This is deja vu. Whether a negotiated deal in Gaza, how many times have the UN,
okay, well, let's talk about specifically what's happening on the ground right now.
Just let me finish.
Sure.
The UN Security Resolution that was passed concerning Gaza, did Israel accept that? Of course it did. 1701. We have been talking with the American involvement. Is Israel willing to accept that? Of course not.
Okay, well, let's talk about what's happening on the ground today. Now, I've seen media reports that say over 90 to 100,000 Lebanese people have been displaced in a matter of just a few days. Now, you've said actually the number is closer to 500,000. So tell us, what is the actual number so far? And perhaps even more importantly, how many people do you fear could be displaced?
So, before the attacks, the communication device attacks, the number released by the DRN, the disaster management side, we had 130,000 displaced. Remember that by that time, there was an escalation of hostilities by Israel, and several, and the populations were internally displaced still into southern areas. Now, especially with the indiscriminate attacks that occurred last Monday, this is a day where Lebanon registered around 600 people who were killed, including 140 women and children, 9 healthcare workers, 2 United Nations staff, and almost 1,800 casualties, people who were injured. That created this, environment of terrorism. And really, this is where we saw people leave en masse from the targeted areas. People saw the videos. The highways were fully blocked. People, some of them stayed 12 to 18 hours in their car, fleeing the southern region. So, currently, in the shelters, there is almost 400 shelters that the Lebanese government has prepared. We estimate that there are around 70,000. These are in the public shelters. We estimate that usually, from our past experience in the 2006 war, the number of people, in whether they are living with friends, family, in homes they rented, or even across the border into neighboring countries, usually are 4 to 5 times as much as there are in shelters. And that's why we really believe that the tally of people who have been displaced is in the probably around 400 to 500,000 individuals.
I mean, the numbers are skyrocketing. You say around 70,000 in public shelters, but 400 to 500,000 people forcibly displaced from their homes. When we consider the fact Lebanon has no state head, it has a collapsed currency, 44% of the population were already living in poverty. Given the current socio-economic crisis they've been facing for some time, how financially prepared is Lebanon able to take care of this situation?
Well, it is very challenging, and whether on different levels, and that's why on top of what you have said, remember that also Lebanon is hosting 1.5 million Syrians who have themselves the Syrian crisis. So indeed, it is extremely challenging, and that's why Lebanon has been working very hard with the international community on having a response plan to allow us to provide the essential needed care for those patients, whether in shelters or in the health system and so on.
And have you reached out to the international community at all? Have you received any pledges?
Yes, already the NRP, or the Lebanese response plan, that has been prepared by UN agencies. There are pledges almost in excess of 140 million, or this is the number that they are working on. Already we have, for example, in the health sector, we have been receiving medications, medical supplies. We've received from Iraq, from Egypt, from Jordan, from Turkey. We've also have from several European countries that supplies on the way. The UK pledged £5 million, I think, through UNICEF, and there are other countries who are supporting that as well. And I believe that this support will be extremely important for us to provide the necessities, the basic needs of whether the displaced population or the population that's being injured.
Okay, so you have received some support, but how challenging is it to approach Arab countries, given that Hezbollah has been engaged in exporting drugs to many of them, arming militias that attack them, and frankly, meddling in their affairs politically?
I think that the Arab countries have been extremely supportive of Lebanon. And remembering, at the end of the day, we are not approaching them to support Hezbollah. We are approaching them to support Lebanon and the Lebanese community. And I think that our Arab friends and brothers understand very well the distinction between Hezbollah and Lebanon and the Lebanese population. This is a propaganda by Israel, which they have used in Palestine, where they try to say that all Palestinians are Hamas and Hamas is Palestinian. And concerning Lebanon, we've also heard it from one of the Israeli ministers, where he considers all of Lebanon is Hezbollah. I think this is an Israeli propaganda. This is not what our, the Arab countries are saying. And our government has been receiving full support from our Arab brothers. And already we have received, as I said, support from Iraq. We have received support from Jordan. We have received support from Egypt. We have support from Tunisia on the way. We have been approached by Morocco. We have been approached by Jordan, Algeria as well. So, the Arab countries, and also, I'm not going to mention the Islamic countries, but a lot of those countries are supportive of Serbia.
Okay, so support certainly has been offered, but how sustainable it is in the long run. Now, of course, the Health Ministry has taken active steps. Back in June, you activated the War Emergency Plan and you began stockpiling around 4 months' worth of fuel, medicine and other necessities. But tell me, has there now been an exhaustion of the reserves given the recent attacks?
Well, actually, we have activated our emergency plan back in October because, as far as, as last October, we knew that we had to prepare. And Israelis, it's not the first time we've been involved with Israel. And Israel, tends to extend, its wars and starts in one place and then, it starts involving other companies as well. So that plan, because we are working in a low resource environment, it was extremely important for us to make sure that our hospitals are prepared for mass casualties, that there is a very good coordination between hospitals, the ambulance services, and that this will allow us to use resources in a way that allows us to preserve them without wasting resources on unnecessary, for example, steps, or for the whole system to respond as one health system, and then we could distribute large number of patients on all hospitals. This is what we had to do 2 weeks ago when we had almost 300 casualties in a matter of minutes. And we had then to activate a total response where 90 hospitals, 1,100 ambulances participated in, receiving those casualties. Now, your question is, for how long can we do it? Can this be sustained? As we see the daily tally of casualties keep rising, as hospitals gets overwhelmed with casualties, can we continue with this? The answer is we are working at nearly full capacity, I would say, and it is becoming more tough as the war breaks on. We are working, however, with our international partners, such as the International Committee of Red Cross, the Médecins Sans Frontières. We have also several emergency medical teams coming from different countries, including the US, the UK, and Norway, and others, to be able to increase the capacity and to be able to receive more casualties should that happen. But
I mean, the recent attacks, for example, the attacks with the...
Sorry, if I could just continue. The diplomatic efforts that are ongoing, in my opinion, are extremely important, because this cannot be solved by increasing, the health sector capacity. This carnage has to be sorted out by finding a way towards a diplomatic solution.
Okay, so what potential shortages are you most concerned about? Beds, hospitals, nurses, supplies? Where are we needing the most support from today?
I think the most challenging would be fuel. I think that, for concerning nurses, hospital beds, medical supplies, medications, as I said, we have been stocking up on our inventory. But clearly, fuel is going to be a critical issue. And, hospitals, ambulances, they all require fuel to function. Now, we have been increasing the renewable energy budgets in our hospitals. 15 of our public hospitals now have renewable energy constituting almost 40% of their energy requirements. Almost 200 of our primary health care centers now completely can work on function on renewable energy. But clearly, I think fuel is going to be critical, and if there is an escalation, further escalation of food.
Okay, well, let's talk about the people that you've been treating in hospital, because you told the BBC in an interview, if you look at the people who were brought to the emergency rooms, it's clear they are civilians. They are not the combatants that the Israelis claim that they are. So, Minister, tell me, who do you think is taking care of the wounded or the slain combatants? Since Hezbollah has been really quite transparent in regularly announcing the death of their fighters.
So, there is clearly combatants part of the people who were injured. I mean, there is no doubting about that. But the vast majority of the people who are being brought to our hospitals and emergency rooms are civilians. And when I was speaking, I was specifically speaking, if I remember, on the Monday attack, where we had the 600 people who were killed and 1,800 were injured. I mean, as I said, among them were 140 women and children, healthcare workers, and UN staff. Now, these are surely not Hezbollah combatants. And if you look at the residential areas, I mean, Hezbollah's combatants, would not be sitting in apartments and, or working in markets. I mean, so that's why, in those specific attacks. But clearly, I'm not saying that Hezbollah competence or there are no competence among people who are rich.
Minister, again, if we look at the political side of it, I have to wonder, despite the support Hezbollah enjoyed until the south was liberated in 2000 and the tight grip it's had on the country since then, frankly, not everyone in Lebanon is supportive, certainly not all Christians, not all Sunnis, and not even all Shia. Are you concerned that the outbreak of another civil war in Lebanon could take place, given that many feel this is a war that has been imposed on them?
Well, there's clearly a lot of people in Lebanon are opposed the politics and what Hezbollah is doing. There's no denying of that. I think, if you talk to people, and as you said, this is across the board. I mean, even within, this is not sectarian. Among all sects, including Shia, you have people who oppose Hezbollah's policies. But unfortunately, what Israel is doing by these indiscriminate attacks, when they attack areas that are Sunni or that are Christian, or when we see even when they are attacking Shia areas, but these are civilians, these women and children, unfortunately, this will only increase the feeling of solidarity with the community where Hezbollah is based. And we've seen this also with Gaza. If you look in the Arab world, the support for Hamas is not high. But when people see the atrocities, the carnage that Israel is perpetrating in Gaza, I think that unanimously, a lot of people have a lot of sympathy with the people of Palestine. And Israel, the way it is conducting its war on Lebanon, has fostered this environment of solidarity. And you could see this, on the day of the attack, on the explosive devices. We at the Ministry of Health, as I told you, we were sending patients all across the country because, we had to have a full response from all hospitals. And even when we were sending patients into hospitals that were in areas that are politically or from a religious perspective, diametrically opposite to Hezbollah. The people who were injured were welcomed, they were cared for, they were given the attention needed. And I think that this is something that, Israel has repeatedly failed to understand, that it's indiscriminate, targeting, or its dehumanization of all, for example, Arabs or communities, would only lead to more of sympathy with the said enemies that would close.
But there have been clashes with some Hezbollah supporters who've been carrying flags and other factions over the past few days. That's taken place in Tripoli as well as elsewhere. Surely a risk of a civil war must be there. So at this stage, can it be averted?
When people look at what Israel is, when they hear the tens of people who are being killed, when they hear of the hundreds of people who are being injured, whatever Hezbollah is doing, we pay in front of what Israel is doing. And maybe if Hezbollah was working in a vacuum, what you are saying might be true. But when whatever Hezbollah is doing is being put with the background of what Israel is doing, then clearly the attention will go back to Israel's atrocities, whether in Lebanon or whether in the...
Yes, but many people don't agree with what Hezbollah is doing. And you can't say that the killing of one group allows for the killing of another group, particularly as many Lebanese people are not in support of what Hezbollah is doing. As I mentioned before, many people feel this is a war that is being forced on them.
If you look at what Israel is doing in Gaza, how that has affected what was happening in the Arab world.
100%. But now the Lebanese civilians are being forced to pay the price.
I will come to your question. But what I'm saying is, if you look at what Israel has done in Gaza and, see the effect of what that has done on the population in the Arab world and the opinion in the Arab world, you will see the same thing as in now. As I said, whatever Hezbollah does, whatever differences there are in Lebanon, in front of this carnage this destruction that Israel is invoking on the Lebanese population indiscriminately. When we are treating in our hospitals casualties who are Christian, who are Sunnis, who are, if he has not sympathized with Israel, with Hezbollah, then all of this, unfortunately, solidifies the environment for Hezbollah.
So tell me, can a civil war in Lebanon be averted at this stage?
Well, living in Lebanon, I don't hear that we are close to a civil war. Of course, we have our differences. And I'll tell you what, as long as Israel is hitting Lebanon, is targeting Lebanon indiscriminately, as long as it is, killing innocent women and children, this will only foster a sense of solidarity among the Lebanese, not of civil war.
Okay, well, Dr. Firass Abiad, the Minister of Health for Lebanon, thank you for joining us today on Frankly Speaking. We do appreciate your time.
Thank you.